Hello everyone, I am Dr. Ratnav Ratan, consultant pediatric orthopedics and sports injuries at CK Bill Hospital, Gurugram. Today I am talking about a very common topic concerning everyone. It's about the bone health in kids, how to take care of bone health, how to build good bones in the kids, how to increase the height, how to take care of the common bone problems of the kids. So why do we need to know that? It's important because bone density during the growing years of age will ultimately determine the bone density in the later age, that means during the elderly age group. So osteoporosis in old age has been linked to a poor bone density in younger kids. So during the growth spurt, that means the second growth spurt around the puberty, if the child doesn't get proper nutrition or has a fall in a bone mass, so they may land up with a poor bone quality later on in life. That is how important it is to have a good bone density, bone mass in childhood. So what do we need to do? So there are the various aspects which contributes to a healthy bone in a child, and of course the most important thing is the diet. So what in diet? So calcium adequate, of course we all know that calcium supplements, adequacy of calcium in our body is very important to build healthy bones, but that is not all. There are other aspects as well to it. Now for an adequate calcium intake, the child needs to take a lot of dairy products, a lot of green leafy vegetables. So all that is very important because calcium forms one of the organic component of the bones, and is about 99% of the calcium in our bodies is found in the bones. So along with calcium, we need vitamin D. The vitamin D helps in calcium absorption in our body. So adequate vitamin D levels is very important for the healthy bones, healthy muscles. Now along with that, it also helps in building the immunity, prevent recurrent infections, especially the upper respiratory tract infections. It has also been shown to prevent various disorders, prevent diabetes, hypertension. There have been conjectural reports of they even preventing some of the cancers later on in the body. So it's important that the child gets adequate vitamin D. Now vitamin D usually is in minuscule quantities in the diet. You do not have a lot of vitamin D rich dietary sources, especially in India, in our country, where we do not have access to the cold fishes, the fatty fishes like sardines, salmon, mackerel. So they have very high content of vitamin D. Then cod liver oil, they all have very high rich quantity of vitamin D. Now of course the most abundant source is sunlight, because vitamin D is synthesized within our skin. The ultraviolet B rays acts on the pre-cholesterol, and that is converted to an activated form of cholesterol, and that is subsequently activated in the liver and then further activated in the kidney. So the activated form of vitamin D is actually formed in kidneys. So it's important that the child is exposed to adequate quantity of sunlight in the day. So the recommendations say that the best time for exposure is between 10 a.m. to 3 p.m. and the darker the child, the higher is the duration of exposure which is required. So in Western population, they say it's around 10 to 15 minutes. Now if we are darker in our shade, so we require almost 2 to 3 times the exposure compared to those countries. So that is how we get vitamin D. Now of course, if the child is exposed to at least 20 to 30 minutes of sunlight at least 3 to 4 times a week, they can expect to get adequate vitamin D, and their levels won't fall. So the best way is to make the child wear some sleeveless clothes or tank tops, or with relatively exposed chest and back and the upper limbs, and the with shorts, so a greater part of the body can be exposed to sunlight. But of course we need to take care that the exposure should not cause burns, should not cause redness on the skin. So it's important that it has to be a suberythemal exposure, because there are risks excessive exposure to sunlight as well, in terms of sunburns, in terms of some of the cancers of the skin as well. So need to be mindful of that as well. So you should not overdo, but definitely an adequate exposure is important. So we can of course time the exposure wherever possible, take them in a safer place where there isn't any much of crowd, and so that they get adequate vitamin D. Now supplements, we talk about the vitamin D supplements, of course less than 1 year every child is supplemented with vitamin D. Beyond that, routinely we do not supplement unless the child has fractures or has some bone disorders, or we see that the child isn't getting enough vitamin D because of sometimes the location of the house is such that no sunlight comes in the house. So sometimes we need to supplement, but that needs to be taken under supervision of your doctor as well. Now it's important that the child maintains a proper body weight, right? So it's important that the child remains active in terms of the exercises, in terms of not giving enough. So what you can do for proper body weight is to maintain proper dietary habits, make the child more active, avoid sedentary lifestyle, decrease the screen time of the child. So these are steps which we can take to manage the body weight. And of course some kids have a tendency to grow fat, then of course they will have other problems. They may land up with weak bones and osteomalacia early in their teens. So we should avoid sedentary lifestyle as much as possible. So then of course for a healthy lifestyle, exercises again play a very important role in building the bone density. So it has been shown in research that the higher impact activities, as in running, jumping, skipping, all the ball games, they load the bones of the kids, and if they do more of these high impact activities, they have high likelihood of having a good bone density. So we should always encourage the child to play for at least 2 to 3 hours a day, with a lot of running, high impact, because the cycling, swimming, all those are mostly cardio exercises. They are good for the heart, for the general well-being, but may not be that effective in building bone density. So the more impact we give on the bones, the higher the bone density. So it's more important that the child runs and load the bones of the legs and the hips. Now among the lifestyle habits, as we discussed, it's important that the child avoid some of the dietary things, especially the junk food, the high calorie, highly processed food should be avoided. The child should avoid soft drinks, because soft drinks have been shown to have a lot of acidity, phosphoric acid, and there are other contents which literally leaches out calcium from the bones. So it's important that any child less than 17 years of age should not be given soft drinks, the carbonated drinks, which are very popular these days. It's important to avoid them. Sometimes it's also important to identify the kids who are at risk population, because despite everything, some kids may have underlying disorders which may cause the bones to be weak, especially those with some amount of malabsorption syndrome, or kids who have milk allergies, who are unable to take milk, who are lactose intolerant. Then there are kids who may be having some of the other disorders which may require them to take steroids. So these medicines can again weaken bones. So these secondary disorders causing other illnesses affecting bones also needs to be identified and appropriately treated. So timely intervention in those disorders is also very important. So to summarize, the fundamentals for a healthy bone in kids is to maintain proper diet, so that the child has adequate calcium. The child needs to take adequate vitamin D from the sunlight. The proper body weight and healthy lifestyle needs to be maintained. Avoidance of fatty food, avoidance of junk food, avoidance of soft drinks, carbonated soft drinks, very important. So lifestyle again plays a very important role. Decrease in screen time, adequate supplements whenever required, management of risk factors whenever there are, and of course a lot of exercises and high impact exercises. So these are the things, these are the interventions to improve bone density in the child. Thank you.